Hello and welcome to the very first new episode of World Parkinson's Program Speaker Series. My name is Dion and I will be the host for the first episode. World Parkinson's Program is a non-profit organization that caters towards Parkinson's patients and caregivers in developing countries through awareness, donations, and education. Please check out our website at pdprogram.org. As I mentioned, this speaker series is brought to you by WPP, or World Parkinson's Program. It was founded by neurologist and world-renowned Parkinson's expert, Dr. Rana. So this will be a series that will feature different guest speakers who are well-respected doctors and experts in a variety of subfields relating to Parkinson's disease. The topics we cover will be fascinating and educational in nature. So without further ado, let me introduce you to our first speaker, the founder of WPP and neurologist, Dr. Rana. Dr. Rana, how are you today?
Fine, thank you.
That's great to hear. So today we will talk about musculoskeletal issues in Parkinson's disease. So that includes musculoskeletal pain, the different roles it plays. So without further delay, let's jump right into it. And Dr. Rana, the first thing I want to talk about is spines. So let me talk about scoliosis. And can you tell me how Parkinson's disease affects scoliosis?
The exact relation between scoliosis and Parkinson's is not quite clear. However, because Parkinson's usually starts on one side of body, one side of body which is affected by Parkinson's first is usually slow, and patients may be bent towards that side. So there is a pressure on the spine being convex to the other side. So if patients have a pre-existing scoliosis, it can make it worse, and patients can get the curvature of the spine, which is interfering with their posture as well as gait.
Okay, great. That's really informational. Do you have any suggestions on how to help this problem?
The exercise, regular and gentle exercises on daily basis could help this. In addition, seeing a physiotherapist's opinion would be useful as well. If patients have pain, then of course the treatment for pain is helpful. If patients have if they have scoliosis in the beginning, so early detection would help to see if something can be done to prevent the complications of scoliosis in future.
Okay, that's very interesting to know. My second question for you is, what is the impact of Parkinson's on bone health?
The bone health is maintained by our daily activity. Our bones are being formed and being dissolved on daily basis based upon our movement. So our movements help to keep the bone health. So because Parkinson's patients, they are slow, they are less mobile, they spend their days sitting, watching TV or being inactive. Especially those who don't exercise on regular basis or go out. So in them, the rate of bone loss may be more than the rate of bone formation because their activity is decreased. So when the rate of bone loss is increased, so these patients develop osteoporosis. The osteoporosis leads to fractures, and the research has shown that the osteoporosis and fracture occurs at a higher rate in patients with Parkinson's, and as disease advances, the risk of having fractures is increased. If patients sustain a fall, which is a complication of moderately advanced Parkinson's disease, these patients can get fractures easily. To prevent bone loss, the patients have to be as active as possible. They should also pay attention to their food, especially a good intake of vitamin D and calcium is always helpful. With respect to calcium intake, they should try to consume foods which are higher in calcium, especially in countries like Canada. The sun exposure is less, so vitamin D may be low in many patients. And also research has shown that vitamin D is less in patients with Parkinson's. Also, although the exact cause of this is not known, when patients are taking calcium, we always advise them to spread their intake throughout the day and take their supplements with the food. This could also help, and weight-bearing exercises are also necessary for these patients.
Okay, great. So that leads to my next question. Can Parkinson's affect the bone of hands and fingers as well? Because we know there's a lot of tremors that come down to the hands. So can that affect the bones of your hands and fingers?
Yes, in Parkinson's, the bone deformities, especially hands or feet, are not uncommon. Hands or fingers are more prevalent because patients are sitting most of the day, and they're sitting in a posture where their elbow is on the armrest of the chair, or their hand is in a certain position, and it is bent it's flexed at the elbow, or as well as at the wrist. So keeping your hand in such a position for longer periods, it can affect the bone health and the shape of the hand on long-term basis. It can also lead to the compression of the nerves, especially those nerves which are somewhat superficial in our limbs. So most patients may get the deformities. As the disease advances, their hand stays flexed, their hand assumes the position of a fist, and sometimes their fingers, they start going into their palm, leading to the breakdown of the skin. So we advise patients to avoid resting their elbows against any hard surface or keeping their limbs in a certain posture all the time, and also keeping a pillow or a padding below their upper extremities, their arms or their elbows. That would help to avoid any compression of the nerve. And sometimes if their hand is constantly in a certain posture, using neutral angle splints might be helpful as well.
Okay, thank you. Those are some great suggestions. Now, we know Parkinson's disease can also cause something called the frozen shoulder. Can you explain or describe to our audience what that looks like, or what are the symptoms of the frozen shoulder?
Right. Some patients with Parkinson's, they develop frozen shoulder much before other motor symptoms of Parkinson's disease. What happens in Parkinson's, as I was saying, because it starts on one side of body, so patients are slow on that side when they are walking. They are not swinging their arm on that side. They are not using that arm as frequent as the other side. So this leads to development of frozen shoulder. So these patients develop a discomfort at the shoulder level. They have pain, so their arm is stiff. They have decreased movements of the arm. So all this contributes to the shoulder problems. And because they may not have other motor symptoms become obvious, so these symptoms of frozen shoulder may be taken for some other problems, such as a rotator cuff, or if patients had a remote sports injury, they might say that while they had a sports injury before, and now this shoulder problem is because of the sports injury. Although this may not have anything to do, because that history is quite remote. So when these patients go to a healthcare professional, such as a GP or a physiotherapist or a neurologist, so when they examine them and they see that side of which the shoulder problem is, that's slow, they're not swinging, this may lead to neurology consultation, keeping in mind for Parkinson's disease. So it is important to recognize shoulder problems in Parkinson's. Sometimes they may start only with a very subtle pain in the biceps area. So anything like this should trigger the examination by a qualified physician.
Okay, great. So there are certain treatments that they can do for this, like exercises or using a heat bath. Is that correct?
Right. With respect to frozen shoulder, if patients don't have other symptoms of Parkinson's, or if they are subtle and these symptoms are not picked up, the patients are not diagnosed. So this may lead to a lot of investigations such as EMG, nerve connection studies, X-rays of shoulders, ultrasound, and sometimes they take the courses of physiotherapy, steroid injections, and we have seen patients who had appointments with surgeons, and once they were diagnosed with Parkinson's and treated, their symptoms started improving. So it is important to recognize them early and treat them. The treatment may be long. This type of problem may take many weeks or months to improve. So range of motion exercises are very helpful. Application of heating pad or a massage, the physiotherapy consultation is also helpful in these problems.
Okay, great. Thank you for those suggestions. Now moving on to our next question. As we know, Parkinson's disease is a neurodegenerative disorder. So can Parkinson's disease affect the peripheral nerve of your hands?
As we were discussing before, the patients, their hands assume certain postures. If patients have tremor, so their hand might move or shake side to side, or sometime upside down, and this type of tremor, because it occurs throughout most of the days when patients are sitting or even if they are walking. So that constant motion at their wrist, as well as sitting in these postures, may have an impact on the peripheral nerves. Some of the nerves are much more prone to compression or injury than other nerves, especially the nerves in the forearm or wrist. So there have been reports that that median nerve compression, which leads to a common condition called carpal tunnel syndrome, which we usually see in typists or those people who work in assembly line or using their hands repetitively, because Parkinson's patients sometimes they are holding a cane constantly when they're walking, or a walker. Their wrist is in an extended position, or if they're sitting, they have hyperflexion at their wrist. So that could lead to carpal tunnel syndrome. And other nerve which is very prone to this type of problem is the ulnar nerve. Ulnar nerve is quite superficial at elbow. So if patients is wheelchair bound, they're sitting with their elbows on the wheelchair, and or they are sitting on a couch and their arm is against the armrest. So that leads to the ulnar nerve compression because it's superficial. So these problems should be screened by physicians, especially on history and examination, and patients should be educated to prevent these abnormal postures so that they don't lead to these issues.
Okay, and suggestion would be they can use pads or pillows under the elbow, something like that.
Right, and they can also use a splint, a elbow brace, or a splint at the wrist, the neutral angle wrist splint, which can keep the hand straight and avoid the compression of the nerve.
Okay, great. That was very informative. So that about wraps it up for our new episode. So thank you, Dr. Rana, for your time and for all the information.
Sure.
So thank you for watching, and please visit our website at pdprogram.org. We're also on Facebook and Twitter, so give us a like and follow us when you can. And this is Dion on behalf of World Parkinson Program signing off.